As we grow older, our bodies naturally undergo various changes, and our eyes are certainly not an exception to this process. Many people over the age of 60 begin to notice that their vision isn't as clear as it once was, a common experience that can make everyday activities like reading, driving, or recognizing familiar faces much more challenging. This blurriness can significantly impact one's overall quality of life. While some alterations in vision are a normal part of aging, there are many proactive steps you can take to protect your eyesight. By incorporating specific daily habits into your routine, you can play a significant role in keeping your vision sharp and greatly reduce your risk of developing serious eye conditions. This discussion will explore why vision might become blurry after 60 and outline 10 straightforward habits designed to help maintain healthy eyes. It is important to understand that certain vision changes as you age are common and expected, while others might signal a medical condition that needs professional attention. For instance, presbyopia is a common age-related change where it becomes difficult to focus on objects up close, such as when reading a book or looking at your phone. This occurs because the lens inside your eye naturally stiffens with age, a change most people notice in their 40s or 50s that continues past 60. Additionally, many older adults experience reduced tear production, which leads to dry eyes. As you age, your eyes might not produce enough tears, or the tears they do produce may not be of good quality, causing a gritty, itchy, or occasionally blurry sensation. Furthermore, decreased night vision is also common, making it harder to see clearly in dim light or after dark. This happens because the cells in your eyes responsible for night vision become less effective, and your pupils, the black centers of your eyes, may not open as widely. Sometimes, however, blurry vision is a symptom of a more serious eye condition, many of which can be effectively treated if detected early. One very common cause is cataracts, where the clear lens inside your eye becomes cloudy, much like looking through a foggy window. These usually develop slowly. Another significant condition is age-related macular degeneration, AMD, which damages the macula, the central part of your retina responsible for seeing fine details and colors. AMD can cause central vision to become blurry or distorted, making activities like reading difficult. According to studies such as the Age-Related Eye Disease Study, AREDS, AMD is a leading cause of severe vision loss in individuals over 50. Glaucoma is another serious condition that damages the optic nerve, the vital connection between your eye and your brain. Often caused by high pressure inside the eye, glaucoma can gradually steal your side or peripheral vision without you noticing until the disease is quite advanced. For those with diabetes, diabetic retinopathy can occur when high blood sugar damages the tiny blood vessels in your retina, potentially leading to blurry vision, dark spots, or even vision loss. Thus, careful diabetes management is crucial to prevent this. As mentioned, dry eye syndrome can also cause blurry vision, especially when tears fail to properly lubricate the eye surface. Beyond these, blurry vision can occasionally be linked to other health issues like a stroke, side effects from certain medications, a retinal detachment where the retina pulls away from the back of the eye, or problems with the cornea, the clear front part of the eye. It is incredibly important to remember that many serious eye conditions can be treated effectively if they are identified early, which underscores why regular eye checkups are so vital, even if your vision seems perfectly fine. Taking care of your eyes does not have to be complicated, as simple, consistent habits can make a profound difference in preserving healthy vision as you age. The most important habit is perhaps scheduling regular, comprehensive eye exams. Many serious eye diseases, such as glaucoma and the early stages of AMD, often present with no warning signs until they have progressed significantly. A thorough eye exam can detect these silent diseases before you even notice any symptoms. An eye doctor can assess the overall health of your entire eye, not just how well you see, looking for problems like high eye pressure, which can indicate glaucoma, or changes in your retina that might point to AMD or diabetic retinopathy, as well as the early formation of cataracts. The American Academy of Ophthalmology recommends that adults over 60 have a comprehensive eye exam every 1 to 2 years, or more frequently if they have risk factors for eye disease. You should aim for an exam at least once a year or as often as your eye doctor suggests, especially if you have a family history of eye problems or other health conditions like diabetes. During the exam, the doctor will check your vision, assess how your eye muscles function, and dilate your pupils with drops to get a better view of the back of your eye. They will also measure your eye pressure through a test called tonometry and examine your retina and optic nerve, all of which are key to catching problems early. Next, it is crucial to adopt a vision-friendly diet. What you eat affects your entire body, including your eyes, as certain nutrients act like superpowers for your vision, helping to protect your eyes from damage and slow down age-related problems. Key nutrients include lutein and zeaxanthin, powerful antioxidants found in the macula of your eye that act like natural sunglasses, shielding your eyes from harmful light. Omega-3 fatty acids, especially DHA and EPA, are important for retinal health and may also help with dry eyes. Vitamins C and E are antioxidants that protect your eye cells from damage, while zinc, a vital mineral, helps move vitamin A from your liver to your retina to produce melanin, a protective pigment in your eyes. A diet rich in these nutrients can help lower your risk of developing AMD and cataracts, and may also reduce symptoms of dry eyes. Clinical trials like the Age-Related Eye Disease Study, AREDS, and AREDS-2 have shown that specific combinations of these vitamins and minerals can slow the progression of intermediate and advanced AMD. To incorporate these into your daily meals, try including leafy green vegetables like spinach, kale, and collard greens, which are packed with lutein and zeaxanthin. Colorful fruits and vegetables such as oranges, bell peppers, broccoli, corn, and berries provide vitamins C and E. Fatty fish like salmon, mackerel, sardines, and tuna are excellent sources of omega-3s, while nuts and seeds like almonds, sunflower seeds, and walnuts offer vitamin E and zinc. Egg yolks are also a good source of lutein and zeaxanthin. You might not immediately connect drinking water with eye health, but staying adequately hydrated is very important. Being well hydrated helps your body produce enough tears, which are essential for keeping your eyes moist and comfortable. If you are dehydrated, your eyes can feel dry, irritated, and even temporarily blurry. Good hydration also supports overall body fluid balance, which is crucial for the health of all your tissues, including your eyes. Make an effort to drink plenty of water throughout the day, aiming for about 8 8-ounce glasses daily, though this can vary based on your activity level, climate, and overall health. Always follow your doctor's advice regarding fluid intake. It is also vital to protect your eyes from UV and blue light, as the sun's rays and even light from digital screens can harm your eyes over time. Long-term exposure to ultraviolet UV light from the sun can increase your risk of developing cataracts and contribute to AMD. While natural blue light is ubiquitous, excessive exposure from digital screens can lead to digital eye strain, making your eyes feel tired, dry, and sometimes causing temporary blurry vision. Research into the long-term effects of screen blue light on the retina is ongoing, but protecting your eyes is always a good idea. To do this, always wear 100% UVA, UVB blocking sunglasses outdoors, even on cloudy days, as UV rays can still penetrate clouds. A wide-brimmed hat provides an extra layer of protection by shading your eyes and face from direct sunlight. You might also consider anti-glare or blue light filtering coatings for your computer screens and eyeglasses, which can help reduce eye strain and discomfort, especially if you spend many hours in front of digital devices. Managing chronic health conditions is another critical habit, as your overall health is closely linked to your eye health. Conditions like diabetes, high blood pressure, and high cholesterol can have serious effects on your eyes. Uncontrolled diabetes, for example, can lead to diabetic retinopathy, where the blood vessels in the retina are damaged, and it can also increase the risk of cataracts and glaucoma. High blood pressure, known as hypertension, can damage the tiny blood vessels in the retina, a condition called hypertensive retinopathy, and it can also increase the risk of optic nerve damage and vision loss. High cholesterol levels can sometimes lead to blockages in the blood vessels of the eye, affecting vision. These conditions can cause blurry vision, vision loss, and increase your risk for major eye diseases, with clinical studies consistently showing a strong link between poor management of these systemic diseases and the development and progression of various eye complications. Therefore, it is vital to work closely with your doctor to manage any chronic health conditions you have, which includes taking your prescribed medications, regularly monitoring your blood sugar and blood pressure, and following all medical advice regarding diet and lifestyle changes. Quitting smoking or never starting is one of the best things you can do for your eyes and your overall health. Smoking is a severe risk factor that significantly increases your risk of developing several serious eye diseases, doubling your risk of AMD and increasing your chances of getting cataracts. It can also damage the optic nerve and worsen conditions like diabetic retinopathy, as toxins in cigarette smoke can reduce blood flow to the eyes and increase oxidative stress, harming delicate eye tissues. If you smoke, quitting is one of the most impactful steps you can take for your eye health and general well-being. Talk to your doctor about smoking cessation programs and resources that can help you quit. For those who spend a lot of time looking at computers, tablets, and smartphones, practicing proper screen habits is essential to prevent digital eye strain, also known as computer vision syndrome. Prolonged screen use can cause blurry vision, dry eyes because you blink less when focusing on a screen, headaches, and neck pain. The American Optometric Association has highlighted the prevalence of digital eye strain in today's screen-heavy world. To prevent this, follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for at least 20 seconds. This simple practice helps your eye muscles relax and gives your eyes a much-needed break from close-up focus. Other helpful tips include adjusting screen brightness and contrast so your screen is neither too bright nor too dim compared to your surroundings, using anti-glare filters to reduce reflections, ensuring proper lighting to avoid working in a dark room with a bright screen or with bright lights shining directly onto your screen, and consciously reminding yourself to blink frequently to keep your eyes moist. Maintaining a healthy weight and exercising regularly benefits your entire body, including your eyes. Regular physical activity and a healthy weight reduce your risk of developing chronic diseases that harm your eyes, such as diabetes, high blood pressure, and high cholesterol. For example, consistent exercise can help improve blood circulation, which is vital for delivering nutrients and oxygen to your eyes. Research published in journals like Ophthalmology often points to physical activity as a protective factor against conditions like glaucoma and AMD by improving overall cardiovascular health. Aim for at least 30 minutes of moderate intensity exercise most days of the week, which could be brisk walking, swimming, cycling, or any activity that elevates your heart rate. Practicing good eye hygiene through simple habits can prevent infections and irritation that can affect your vision. Always wash your hands thoroughly before touching your eyes to prevent transferring germs. If you use contact lenses, follow cleaning and replacement schedules rigorously, as improper contact lens care can lead to serious eye infections. Always use fresh solution and replace lenses as directed by your eye care professional. Avoid rubbing your eyes excessively, as this can irritate them and potentially cause damage to the cornea over time. Lastly, use fresh, clean towels for your face, as dirty towels can harbor bacteria that can cause eye infections like conjunctivitis, also known as pink eye. Finally, getting adequate sleep is crucial because your eyes work hard all day, constantly adjusting, focusing, and reacting to light, and they need time to rest and recover. Sufficient sleep allows your eyes to repair and rejuvenate, providing a break from constant focusing and exposure to environmental elements. This helps reduce eye strain, dryness, and puffiness, as a lack of sleep can lead to tired, irritated, and sometimes blurry eyes. Aim for 7 to 9 hours of quality sleep per night, and establishing a regular sleep schedule and creating a comfortable sleep environment can significantly improve your sleep quality. Beyond these daily habits, incorporating specific foods and understanding certain supplements can further boost eye health. For example, making foods rich in eye protective nutrients a regular part of your diet is a delicious way to support your vision. Lutein and zeaxanthin, powerful antioxidants, are found in high amounts in spinach, kale, collard greens, turnip greens, other dark leafy greens, corn, green peas, broccoli, egg yolks, and orange bell peppers. Omega-3 fatty acids, essential for retinal health and potentially reducing dry eye symptoms, are abundant in salmon, mackerel, sardines, tuna, especially wild-caught varieties, as well as plant-based sources like flax seeds, chia seeds, and walnuts, though the body converts them less efficiently than fish sources. Vitamin C, a strong antioxidant, helps protect against cataracts and AMD, and can be found in citrus fruits like oranges and grapefruits, bell peppers, particularly red and yellow ones, broccoli, strawberries, and kiwi. Vitamin E, another antioxidant that protects eye cells from damage, is present in almonds, sunflower seeds, hazelnuts, wheat germ, avocado, spinach, and kale. Zinc, which helps bring vitamin A to the retina and is important for night vision, is found in oysters, beef, poultry, beans, lentils, and nuts, especially cashews and pecans. Certain activities are also beneficial. Spending time outdoors, particularly during childhood and young adulthood, has been linked to a reduced risk of nearsightedness. For adults, natural light exposure, always with proper UV protection, can benefit overall eye health and mood, but remember your sunglasses and hat. Additionally, practicing mindful blinking is important because when we concentrate, especially on screens, we tend to blink less often. Consciously reminding yourself to blink fully and frequently helps spread fresh tears across the eye surface, keeping your eyes moist and clear. While a healthy diet is the best way to obtain nutrients, some individuals, especially those at risk for certain eye conditions, might benefit from supplements. However, always talk to your eye doctor before starting any new supplement. The AREDS 2 formula is a notable example. The Age-Related Eye Disease Study, AREDS, and AREDS 2 were landmark clinical trials demonstrating that specific supplement formulas can slow the progression of intermediate and advanced age-related macular degeneration, AMD. This is a significant finding for people already diagnosed with AMD. The original AREDS formula contained vitamin C, vitamin E, beta-carotene, zinc, and copper. The AREDS 2 formula, which is now generally recommended, replaced beta-carotene with lutein and zeaxanthin because beta-carotene was found to increase the risk of lung cancer in smokers. The specific dosages used in the AREDS 2 study are vitamin C, 500 milligrams, vitamin E, 400 IU, zinc, 80 milligrams as zinc oxide, copper, 2 milligrams as cupric oxide, lutein, 10 milligrams, and zeaxanthin, 2 milligrams, which are often available as specialized eye health supplements following this formulation. It is crucial to consult an eye care professional before taking AREDS 2 supplements, as they are specifically recommended for individuals with intermediate or advanced AMD, not for preventing AMD in healthy eyes or treating early AMD. If you smoke or used to smoke, the AREDS 2 formulation with lutein and zeaxanthin instead of beta-carotene is safer. Omega-3 fatty acids, EPA and DHA, are healthy fats that are important components of the retina. Clinical research, including studies published in journals like Ophthalmology, suggests that omega-3 fatty acids, particularly DHA, may help protect against AMD and are often recommended to help alleviate symptoms of dry eye syndrome by improving the quality of tears. For dry eye symptoms, dosages often range from 1,000 to 2,000 milligrams of total EPA plus DHA per day, while for general eye health, a lower daily dose might be sufficient. You can find omega-3s in fish oil capsules, and for vegetarians or those with fish allergies, algal oil is a plant-based source of DHA. High doses of omega-3s can thin the blood, so if you are taking blood thinners or have a bleeding disorder, discuss this with your doctor before starting these supplements. Lutein and zeaxanthin are carotenoids that act as powerful antioxidants, highly concentrated in the macula. They filter harmful blue light and protect the macula from oxidative damage. Studies including parts of the AREDS 2 trial have shown their importance in maintaining macular health and potentially reducing the risk of AMD progression. Typical recommended daily dosages are 10 milligrams of lutein and 2 milligrams of zeaxanthin, the amount found in the AREDS 2 formula. These are widely available as individual supplements or combined in eye health formulas and are generally considered safe, but always follow dosage instructions and consult your doctor, especially if you have existing health conditions. Emerging research suggests that vitamin D may play a role in reducing inflammation and protecting against AMD, with some studies indicating that people with higher vitamin D levels may have a lower risk of developing AMD. However, more extensive clinical trials are needed to fully understand its role in eye health. The appropriate dosage of vitamin D varies greatly depending on individual blood levels and needs, often recommended based on a blood test to determine if you have a deficiency, with typical daily doses ranging from 1,000 to 5,000 IU. Available in soft gels or tablets, vitamin D is a fat-soluble vitamin, meaning it can accumulate in the body at high doses, potentially leading to toxicity. It is therefore very important to consult your doctor for appropriate dosage and regular monitoring of your blood levels, and you should never self-prescribe high doses of vitamin D. While routine eye exams are essential, some symptoms mean you should see an eye doctor right away, even if it's not time for your regular checkup. These include sudden vision changes, such as abruptly experiencing blurry vision, a partial or complete loss of vision in one eye, or vision that seems distorted, like straight lines appearing wavy. You should also seek immediate attention if you see many new floaters, which are tiny specks or cobwebs that drift across your vision, or experience flashes of light, especially if they are accompanied by a dark curtain or shadow over your vision, as this could be a sign of retinal detachment. Persistent discomfort, tenderness, unusual redness, or swelling in or around your eye, as well as double vision where you see two images of a single object, are also reasons to see a doctor promptly. If you suddenly start seeing rings or halos around light sources, especially if accompanied by pain, or if you notice a sudden or significant worsening of your ability to see in dim conditions or at night, it's time to seek professional help. Finally, if anything about your eyes feels off, or if symptoms do not go away, it is always best to get it checked by an eye care professional. Blurry vision can be a concerning part of aging, but it certainly does not have to be an inevitable one. By understanding the common causes and actively adopting proactive vision care through consistent daily habits, you can make a significant difference in maintaining your eye health after 60. Remember, small, consistent efforts in your daily life can have a profound impact on preserving your precious eyesight. Prioritize your eye health today by implementing these practical habits and working closely with eye care professionals. Your vision is a gift. Take steps now to protect it for years to come.